Infections are also related to inflammation of the prostate gland. I'm not saying that an infection is the cause for prostate cancer. I'm just saying that we should look at other things and ways by which we can protect the prostate gland in itself. About 366,000 men lose their life every year all around the world to prostate cancer. Yeah, I know when you compare it to the world population of, let's say, 7 billion, and you compare it to the number of deaths from other crises or occurrences, you may feel that 366,000 people, men succumbing to prostate cancer is quite small. But when you consider, assuming that man who suffers from prostate cancer is a relative, let's say your father, your brother, your cousin, your uncle, or whoever suffers it, then it becomes a personal issue. This issue of prostate cancer, when there are various searches, if you do a search online, which you can always do by yourself, you will see that. So maybe I can read a few for you. You will see that when they talk about prostate cancer, they usually talk about the causes of prostate cancer, and they never mention an infection. So most times when they talk of the causes of prostate cancer, they talk about age, they talk about family history, they talk about obesity, diet and genetics and other factors. They never mention an infection. I'm not saying an infection is the cause, but in this video, we are going to look at how infections are also related to inflammation of the prostate gland. I'm not saying that an infection is the cause for prostate cancer. I'm just saying that we should look at other things and ways by which we can protect the prostate gland in itself. So you see this book here. So this book, I provided the audio online, and for those who wanted to listen to it, they are probably listening to it. But the audio may not give you all you want. For example, you don't have an index like you would have in this book, in the audio. From my previous videos, I've done posts on the valuableness of this book. I don't know if I've done a video. Maybe if I haven't, I'm going to actually do one. This book was published several years ago, but my father bought it some time ago. And when I was young, I read it. All of us in the family were read it. So we had an understanding of illnesses in general. But my mom used it since she was the home nurse at the time. But over time, when different issues came up, when there was a time I was battling with ulcer, I came back and I read this book. And this book was of great help. So basically, why this video is being done is in order for us to look at prostate cancer. I know this book may be an old book, but a lot of the technology and science that we have today are from over a century ago. So yeah, although we have recent science and technology, but there are some that have been over a century ago. So we'll look at it at least to what is valuable in this book. By the way, I'll leave a link for how you can purchase this book on Amazon. I'll leave a link for you there. So I've opened up a few pages on this where I go straight to the appendix. Like I said in the video online, you can't really see the audio of this book. You can't really see the index. But here you see this is the index. And so in this index, if you go down to prostate gland, so under prostate gland, you have cancer. It shows you the page 567. It talks about lower back pain. It also talks about venereal disease. So if we go to page 5, and that venereal disease is on page 213. So if we go to page 567 of this book, where it talks about the prostate gland, so I'll show it to you. It's talking about the prostate gland. So you see here, let me just read it out. It's just a short paragraph. It says, during the later years of life, many men suffer from enlargement of the prostate gland. This interferes with the normal flow of urine from the bladder, so that a low-grade infection may develop and spread up the ureters to the kidneys. The patient may complain of chills, fever, pain in the back and the side, as well as some discomfort and slowness in urination. Remember, slowness in urination, as well as affecting the normal flow of urine. So it's not likely that he's saying the urine is going to be faster. It's more likely that the urine is going to be slower. So he may also suffer from high blood pressure, headaches, fatigue, anemia. As soon as the infection is brought under control, the patient could have an operation for the removal of the enlarged prostate gland. Transurethral resection is the most frequently recommended prostate operation today. When it says today, we are talking of several years ago, because this book was published, I believe, 1970s. So we need to be sure. Okay, it was published in 1973. So you need to be sure what is current today. So you need to consult a medical professional for that. So when he talks of cancer, that's prostate cancer, he's talking of cancer of the prostate can often be kept under control by the use of very large doses of female hormone. Again, this is from 1973. So again, from the appendix, I mentioned something about the appendix under prostate gland. So he talks about venereal disease on page 213. So I've already bookmarked it here. So this is page 213. So you see under here, we are talking about gonorrhea and other venereal diseases. So let me go ahead. So I'm looking for where you actually have. Okay, so what complications of gonorrhea? So if you look under complications on page 213, you will see that not only is there pain and discomfort in both sexes during the acute phase of gonorrhea, that's both male and female, but many cases of sterility result from this serious infection. In the male, the prostate gland becomes infected and there may be narrowing of the urinary canal. Note that narrowing of the urinary canal, meaning that the flow of urine is not going to be normal again. Most likely it's going to be slow. So if you associate it with what we saw under the prostate gland and prostate cancer, simultaneous occurrence does not actually mean causality, but at least it's something for us to take as noteworthy. So let me continue. So in the male, the prostate gland becomes infected and there may be narrowing of the urinary canal, resulting in slow urination. So he talks about other things. So it's basically from this book, Your Guide to Health. So let me drop that and then come to present day search. I did some search. I told you about it just now, where we looked at the number of deaths of men every year due to prostate cancer. We've looked at that. Then I looked at the causes. So they talk of age, they talk of race, family history, obesity. They never for once mention an infection. So I now did a search. Does gonorrhea cause enlargement or inflammation of the prostate gland? So after doing that search, I got an AI overview. So it says gonorrhea is a sexually transmitted infection, STI, that can lead to prostatitis if left untreated. Prostatitis can cause pain in the pelvis and groin, discomfort when urinating, and flu-like symptoms. So other complications of gonorrhea, so it talks about infertility. So some of the causes of infertility may be due to gonorrhea or venereal diseases. We'll go into that video my next video is going to be on venereal diseases. We'll look at it and find out probably that's one of the reasons people get sterile. So looking at this, you now have prostatitis. So swelling of the small walnut-sized gland, which is the prostate, that produces seminal fluid. So you see that prostatitis is the enlargement of the prostate gland due to an infection. So these enlargements, you may say, or even say acute bacterial prostatitis, or maybe even a bacteria. So we may say, prostate cancer is not caused by an infection. But even if prostate cancer is not caused by an infection, but prostatitis is caused by an infection that affects the prostate gland, which also results in inflammation. It may not be enlargement, but inflammation and enlargement, they actually, I won't say they are synonyms in general, but medically they may be different. But inflammation is increased in size, enlargement is increased in size. Again, I'm not saying simultaneous occurrence is a proof of causality. I'm just saying that these things need to be checked. So when you talk of infections and how it affects a person's prostate gland, I believe that if someone takes their sexuality more serious and try and avoid all of these infections, because sometimes we take all these things for granted, and try and avoid some of these infections, it's possible that it can actually prevent inflammation of the prostate to whatever level you can actually achieve it, even if it's not a risk factor for prostate cancer. But in prostate cancer generally, what they talk about in terms of to reduce the risk of prostate cancer, and when it occurs, you have to find a way to treat it. But to reduce the risk, it talks about eating a healthy diet, maintain a healthy weight, exercise regularly, limit calcium intake, avoid smoking and heavy use of alcohol, control blood pressure, blood sugar, and cholesterol levels, then keep stress levels low. Those are basically what are mentioned for reducing the risk of prostate cancer for a person. So this is what I just wanted to highlight about the prostate gland, prostate cancer, as well as how infections can affect the prostate gland. This is your guide to health, a regimen for you and yours.